Hello students, in this video we're talking about septic arthritis. And before we begin this video, make sure that you subscribe so that you can be updated with our upcoming videos, and there is a link in the description that will take you to the website where you find more main other stuffs like some other educational videos. Make sure that you click on that link. Alright, so now in this video we're talking about septic arthritis. So what we'll do is we'll talk about this, the definition of septic arthritis, the risk factors, etiology, pathophysiology and clinical features, the routes of microorganism, as well as the diagnosis and the general management. So it's a lot, but make sure that you pay attention so that you can be following whatever we're going to be discussing here. All right. Now, what is septic arthritis? So if you remember from the previous video, we said arthritis basically is just the inflammation of one or more joints. Okay, that is what we call arthritis. Now, if you put now septic, we're just talking about it. The cause of arthritis is because of what? Microorganisms such as bacteria, maybe fungal, or maybe parasitical, rarely viral. Okay, so in short, septic arthritis, it is just the inflammation of the joint caused by different microorganisms, which is very simple definition. So what is this septic arthritis? We are saying basically it's just the inflammation of joints due to what? Due to microorganisms. So these microorganisms can be a lot. So I say this microorganism can be maybe bacterial in origin, which is the most common cause, as well as we can have fungal, we can have parasitic, and we can have maybe viral. And if you see something like that, basically that would be under septic arthritis. Very basic definition. Okay. Now, the next thing that we can ask yourself is how do patients what is the population that can have this septic arthritis, okay, or the inflammation of the joint caused by what? The microorganism. What is that population? Okay, the population, for that we'll talk about the risk factors. Okay, so those people that are at increased risk of developing septic arthritis, what are those? So we need to be aware of that, because if you want to diagnose fully septic arthritis, basically you're going to take history of that patient. Okay, so you need to pay attention of that. So what is the first important risk factor? We know there are a lot of risk factors, but we'll just choose like the common risk factor that you can remember. Okay, so what is the first one? The first one is, we'll start with age, which is extremes. So let us use blue. Okay, so we'll talk about extremes of age. Extremes of age. So what does that mean? So it means that in children, septic arthritis is common, okay, as well as in elderly, okay, it is common. So that's why extremes of age is one of the risk factor of septic arthritis. Okay, so what is the other one? Maybe someone who is immunocompromised. Okay, so in population with immunocompromised patient, those patients or people, they are at increased risk of developing septic arthritis. A good example that I can give here for immunocompromised patient, like patient with HIV and AIDS. So HIV and AIDS, basically those people, their immune system is decreased, giving more chance for microorganisms to invade and cause inflammation to those joints. No wonder immunocompromised patient is one of the risk factors. Okay, let's go to another one. what is the other risk factor that we know? Okay, the other risk factor that we know that someone who has CKD. What is CKD? Chronic kidney disease. This they are at increased risk of developing septic arthritis. Okay, and maybe population or some people with liver disease, and maybe abusing alcohol. Okay, those people they are at increased risk of developing septic arthritis. Okay, and another important risk factor that I can add here is this one. Drug abusers. Let us just say IV drug abusers. Okay, so drug abusers. Okay, so drug abusers like IV drug abusers, those are at increased risk of developing septic arthritis. Why? Because those people, every time they want to take those drugs, they get a dead needle and introduce into the bloodstream. Along that, there will be microorganisms that will be introduced to the bloodstream, causing septic arthritis or inflammation to the joint. Okay, and the last one that I can add here, it is sexually active people or adults, sexually active people or sexually active adults. Okay, so those people who are sexually active, basically they are also at increased risk of developing septic arthritis. Why? Because there is a certain organism which is Gonococcus neisseria. It is transmitted via sexually. Okay, and that Gonococcus neisseria can go into the joint and cause septic arthritis. So these are the common risk factors that you can remember, okay, and this can help you in different scenarios. Okay, now next, since we know the risk factors, now we need to understand what could cause septic arthritis. Since we know these conditions, yes, these people can develop septic arthritis because of these risk factors. Okay, but what are the causative organisms of septic arthritis? So let us write on that. The first one is the most common cause. So we'll start with gram positive. So gram positive bacteria. Okay, we're going to start with Staphylococcus aureus. Okay, so Staphylococcus aureus is a gram positive bacteria, and it is the commonest cause of septic arthritis in about what? 50% to 60%. Okay, so you find to say if someone is having septic arthritis, basically the first microorganism that you need to suspect is what? Staphylococcus aureus. And Staphylococcus aureus is what? It is a bacteria. Okay, so in short, septic arthritis, the most common causative agent of septic arthritis is what? The bacteria. It is bacterial in origin most of the time. Okay, basically, and the commonest cause out of all those bacteria or microorganisms, it is what? Staphylococcus aureus, which is the gram positive bacteria. Okay, then what else? We've got other types of gram positive bacteria that can also cause septic arthritis. We have streptococcus. Okay, we have streptococcus organisms. Okay, we've got streptococcus organisms like what? We've got Streptococcus pneumonia. Okay, we've got Streptococcus pneumonia. We've got Streptococcus pyogenes. Okay, and the group B. Okay, and group B. These are also common causative agent of what? Septic arthritis. So you need to take note of that. If a gram positive bacteria can cause septic arthritis, what do you think the other bacteria that can cause septic arthritis. Also, gram-negative bacteria. Okay, so gram-negative bacteria also. So gram-negative bacteria, they also causes septic arthritis. Okay, these include Pseudomonas. Let's just say Pseudomonas A, Pseudomonas aeruginosa. Okay, can cause septic arthritis. What else? We have also E. coli. Okay, E. coli can cause what? Septic arthritis. Okay, and we can have Klebsiella as well. Klebsiella. Okay, Klebsiella. Okay, so Klebsiella as well as E. coli, Pseudomonas aeruginosa, those are the causative agent of what? Septic arthritis, and they are gram-negative. Okay, so you need to know the gram-positive and the gram-negative what? Bacteria. Okay, and the other one that I can write here is remember what I talked about? Sorry. So remember what I talked about. I said to say in sexual active people, what do you think the causative agent for sexual active people? It will be now gonorrhea. Okay, Gonococcus neisseria. So let's just say G. neisseria. Okay, so Gonococcus neisseria is a commonest cause of what? Sexual active people for septic arthritis. So you need to take note of that. Okay, then apart from that, also Mycobacterium tuberculosis can also cause septic arthritis. So you need to take note of that. Someone who is having tuberculosis, TB, they're having TB, basically in due time they can also develop what? Septic arthritis, and the causative agent for that, then we can conclude to say that would be Mycobacterium tuberculosis. Okay, and also a typical Mycobacterium as well can cause septic arthritis a lot. So these are the causative agent of what? Septic arthritis. Someone with this risk factor, then these can have an opportunity now to cause what? Septic arthritis. Now, the next thing that we need to talk about is what? The pathophysiology. Very important part now. So you need to now pay attention, because pathophysiology, if you know it, basically it will also tell you the clinical features. Okay, so pathophysiology can help you to know the clinical features of a certain septic arthritis. Okay, so now let's start simply. So we start by how these microorganisms find themselves in what? In a joint, causing this inflammatory cascade, or the inflammation that we're from talking about. How do they find themselves in that joint? So then we are going to talk about the routes of what? Administration of those bacteria to the joint. So how many routes do you know? We have about what? 3 routes in which the microorganism can use so that they can go into the what? The joint. Okay, let's start with the first one. So the first one is the most common route that the microorganism uses. They use what we call hematogenous route. So they use this one, hematogenous route. Okay, so hematogenous route, basically it is the common route that is used by what? By this microorganism. And hematogenous, what does it mean? It means that those microorganisms, since we're talking about the bacteria in origin, they like to go into blood and find themselves, now that those blood vessels, they will transport those bacteria to the joint site, so that now inflammation can start. Okay, so that's the common cause, the common route, I mean. Then the next route is direct inoculation. So direct inoculation. So direct inoculation, what does it mean? It means that now this bacteria, instead of using the blood vessels to go to the joint as the route, but it will be just introduced direct to the what? to the joint. Okay, so like if I get Staphylococcus aureus and I just put it direct to the joint, then that will be now the direct inoculation. But how can someone have those bacteria being introduced direct to the joint? It is because of what? It is because maybe someone is having had a road traffic accident, trauma, okay, can do that. Open fractures can do that. What else? Maybe there are some drug abuse users. They accidentally maybe inject themselves on the joint like that, direct like that. Then those can cause what? A direct inoculation type of what? A transmission. Okay. Then what about hematogenous? How do those bacteria find themselves in what? In blood? It's because maybe someone had an upper respiratory tract infection, okay, or pneumonia, or maybe the skin infection. Those bacteria, since they have that ability to invade the blood vessels, either way, on either like any part, okay, of the body. So if the moment they just enter into the blood vessel, then they'll have that higher chance to go to the joint and it cause inflammation. So that's how hematogenous spread comes about. Then the last one is what? The last one is contagious. Contagious, okay? Type of spread. Okay, so contagious spread, it means that maybe this bone, as you can see, this bone, it is infected. Okay, it is infected due to some certain organism. Might be Staphylococcus aureus is infecting this upper bone or this bone like that. And what do we call that? We call it osteomyelitis. Maybe someone is having an adjacent infection of the bone, and this infection can be spreading like that slowly up until it reaches the joint, like osteomyelitis. So that's what we call contagious. Contagious, it means the infection is coming from what? The adjacent bone infection, or maybe adjacent tissue like that, and going into the joint space, causing inflammation. Okay, so these are the three main ways in which bacteria can be introduced into the joint space. All right. Now, since we know the routes, now we can go to the pathophysiology now. So what we do here is, since hematogenous spread is the most common, so this is the most common, the hematogenous spread is the most common, basically is the one that we use to explain the pathophysiology. Okay, so now before I go to this diagram, let us understand the basic anatomy of the joint, because remember, if you don't know the basic anatomy of the joint, it will be very difficult for you to understand the pathophysiology. All right? Okay, so now let us try to remember the basic anatomy of this joint. And remember that we've got different types of joint in our body, but the one that we're using, it is the synovial joint, the type of the joint that contains synovial fluid. All right? Okay, because the reason why we're using this one, because it's a type of the joint that is common affected in septic arthritis. All right, so we'll start from outside going inside. So this outer part, okay, this outer part, we call it what? A ligament. But just to give you an overview, remember from the other video we talked about the anatomy of this joint, and we said to say starting from what? Outside, then going inside. So remember that we start with what? The skin. Okay, then after the skin there is the subcutaneous tissue. From subcutaneous tissue, now you can have now the deep fascia. From the deep fascia we can have now tendons and muscles. From the tendons and muscles, now that's when you can have this outer part, now this part which we call the ligament. Okay, so now here I'm going to be just abbreviating so that we create more space. Okay, so this is the ligament. Okay, ligament. And if you look at the next layer there, the black one, that is now the capsule, the fibrous capsule. So this black thing there, that is what we call the fibrous capsule. Okay, the fibrous capsule. And just to recap, remember that the fibrous capsule and this red layer there, the red layer there, that what we call it? We call it what? Let us use blue for this one. We call it what? Synovial membrane. Okay, or let's just say synovium. Okay, so if I say synovium or synovial membrane, it's just the same. Okay, synovium. So now, fibrous capsule and synovium, they make up what we call the joint capsule. Okay, joint capsule. Okay, so you need to take note of that. So the fibrous capsule and the synovium makes up what we call the joint capsule. Very important part of pathophysiology. We'll look at that. Okay. Then this part, as you can see now, this one, we know that this is the articular cartilage. We just name it what? A. That's the articular cartilage, and the fluid inside there, then that's what we call the synovial fluid. All right. And this bone, as you can see, this bone which is here, which is beneath the articular cartilage, we call it subchondral bone. This one, we call it subchondral bone. Let's just say CB, subchondral bone. Now, if you know this basic anatomy, now we can proceed to the pathophysiology. Okay? So what I'll do is, as you can see, this red layer, we say that is synovium or the synovial membrane. So I'm going to get this synovial membrane and magnify it. Why magnifying synovial membrane? Because septic arthritis firstly is going to affect the synovial membrane, then after that it will start affecting other structures, or maybe the articular cartilage, like that. So if we magnify the synovial membrane, it will look like this. Okay, why is it looking like that? Because this red part, it is a blood vessel. Basically it is what? A capillary. Okay, and this red part, that is the what? Synovium. Now, so the synovium, if you remember, it is comprised of what? Two important cells, the type A cells and the type B cells, or the synovial side type A and the synovial side type B. So what I'm simply saying is that the synovial membrane, which is this one, okay, the synovial membrane has what? Two cells, type A cells and the type B cells, or the synovial side type A and synovial side type B. Type A, they fight against infection, and type B, they just participate in the synovial fluid production. Okay, the components that are there, it's because of what? The synovial side type B cells that produces them. Okay, so you need to understand about that. Now, if you look at this one, the most important thing is looking at the blood supply of those synovium. Okay, so the blood supply, it is supplied by what we call fenestrated capillaries. So these are what we call fenestrated capillaries. So these are what we call fenestrated capillaries. Okay. So as you can see, the reason why we're saying fenestrated capillaries, as you can see, there's much space there between the two endothelial cells. And these are endothelial cells. This one and this one, these are endothelial cells making up these fenestrated capillaries. Okay? Now, since there is a space here, and normally, if you remember, if you have a blood vessel, okay, if you have a blood vessel like that, these are endothelial cells, and remember that all the blood vessels are going to be lined by what? A certain connective tissue, which we call basement membrane. And these fenestrated capillaries in the synovium there, they do not contain the basement membrane. And due to that, it is the main reason why microorganisms have that ability now to go into the joint space coming out from the what? Those fenestrated capillaries. Okay? So what we are saying is that if we get a microorganism here, maybe we get the Staphylococcus aureus. So let us represent, this is our Staphylococcus aureus. Okay, and since there are some spaces there, they can easily penetrate the joint cavity. Remember that this is the cavity. If this is the synovium, and now this is the joint cavity from this side, they can easily find themselves where? Here. Okay. So meaning that we need to write the first step. The first step of this pathophysiology is what? Microorganism what? Penetration, or bacterial entry. Okay. So the first is what? Bacterial entry. Remember that how do these bacterial microorganisms enter into the joint cavity? It's because the synovium, it is highly vascularized and it contains fenestrated capillaries that do not contain the basement membrane. And due to that, the microorganisms have that ability now to move from the blood vessels and enter into the what? The joint cavity. Okay. Now, if you look at these bacteria that have now entered into the joint cavity, what are they going to start doing? They'll start multiplying. What's the main reason why they multiply? Because in a joint cavity, there are few like white blood cells that are there, like this type A, the synoviocyte type A. These are very, very few, meaning that they won't manage to clear out these microorganisms that have invaded. So the next step that we're saying is what? Multiplication. So I'm just going to say bacterial multiplication. Okay. So the next step is what? Bacterial multiplication. No wonder, just from these two important points, you need to understand to say this septic arthritis, it is mostly considered as what? An acute infection, or an acute infection of the joint. Why? Because this bacterial entry and multiplication can simply happen in what? Few hours. Okay, maybe within 24 hours this can happen. So no wonder sometimes it is what? An orthopedic what? Emergency. You need to understand on that. Okay. What is the next thing that you need to understand now? So this bacteria now, what they will start doing is this. They will start now activating these cells. Okay, they will start adhering to those cells and now activating those cells. Reason why? Because these are foreign invaders. So this type A synoviocyte, they will start producing what? Some certain cytokines. Okay, so these now, since they've invaded, they are like interacting with the bacteria there, they'll start producing what? Cytokines. Why producing cytokines? So that now they can get help from what? Nearby blood vessels, so that now they can fight against those foreign invaders. So they start producing cytokines like what? Interleukin 1, interleukin 6, interleukin 8, and also tumor necrosis what? Factor alpha. Okay, these they'll go into what? The blood. They'll go into the bloodstream there. From the bloodstream now, remember that there are now important cells that are there. What is this cell? This is what we call a neutrophil. So these cytokines, they'll go into the bloodstream there and start calling the neutrophils to go and help clear out the what? The infection inside the what? Joint cavity there. Okay, so that's what will happen. And remember that the other important thing about these interleukins or cytokines, they can also go to the what? They can also go to the brain, okay, in the hypothalamus there, and causing what? Fever, as well as they can like cause loss of appetite, malaise, fatigue, all those constitutional symptoms. They come because of what? The production of these cytokines. Okay. So now, what is the next important step that we're talking about? So we're talking about now inflammation or host response. So we're just going to say host response. Okay, so we're going to say host response. So host response meaning that these they're going to what? These cytokines have been produced and they're going to target what? The neutrophils there. From the neutrophils now and other white blood cells that are nearby. Not only the neutrophils, but also other white blood cells. These white blood cells or the neutrophils, they'll start now going to the what? Where the infection is. Look at this neutrophil. Okay, this is the neutrophil, which is inside the joint cavity. They'll enter here so that now they can help clear out that what? Foreign invader. Okay, so that's the most important thing. Now, another important thing that since host response is responding by inflammation, okay, now there will be something that will be what? Resulted because of that. So this is now pus formation. Okay, Step number 4 is what? Now pus formation. This one, why there will be pus formation, it is because of what? These neutrophils, now they are here, then they'll start doing the same thing like synovial sites type A. They'll start producing cytokines like tumor necrosis factor alpha, interleukin 1. They also start producing what? Prostaglandins. Okay, so these they do a lot. Okay, now this pus formation, if you remember, pus is comprises of what? It's going to comprise of what? White blood cells, the dead necrotic tissues there, and also maybe some fluid. That's what we call pus. So pus formation is as a result of what? These cells that have entered now, trying to fight against these foreign invaders, the pathogens. Then maybe somehow they destroy the nearby tissues, resulting in what? Necrotic tissue. Then what else? Also these cells, these white blood cells can die, and they can combine with everything. The white blood cells, they can combine with the fluid, they can combine with what? Bacteria. And that they can now form what we call pus. Very important concept, because in septic arthritis, pus formation or purification is what? There. Okay, you need to take note of that. Now, remember now what I said. Since this one, we are having a lot of inflammation, massive inflammation in the joint cavity. What do you think is going to happen now? Now, there will be a lot of edema, because now these interleukins that were produced and being produced by the neutrophils that are there, they are going to vasodilate the blood vessels, those capillaries that are there, and there will be massive increase of what? Fluid, or the plasma coming from the what? The blood vessels, and enter into the joint capsule, causing what? Accumulation of what? The synovial fluid. Okay, resulting in what we call increase in what? Intraocular pressure. So this has the increase in what? Intraocular pressure. So what we are saying is that since there is now massive inflammation because of these neutrophils that are here, now they'll start producing what? Interleukins, tumor necrosis factor alpha, prostaglandins. Then because of that, there will be accumulation of what? Fluid, because the fluid is coming from where now? It is coming from the plasma, then enter into the joint space here, so that now there will be what? Accumulation of what? Synovial fluid. That accumulation of synovial fluid now, it will cause the increase in intra-articular pressure. Articular pressure. Okay. Now this pressure, it has a lot of disadvantages. Okay. So since this, if you look at this joint here, now what we are saying here, the fluid which is here now, it has entered into what? This joint. Okay. As you can see now, what's happening. So since there is a lot of fluid which is here, and there is a lot of pus here, what do you think? There will be enlargement of what? The joint capsule. As you can see, the joint capsule is made up of the synovium and the synovium and the fibrous capsule. They are going to be what? Distended like that. Okay. And what else? If now there is the synovium is being distended or compressed, remember in the synovium, that's what capillaries passes from. Okay, so mean that in the increase in the intra-articular pressure, it's going to start making sure that what there will be now compression against what the important blood vessels. So what we are simply saying is that number 6 is what ischemia will result now. So ischemia of tissues now will result. So this is now the most important and crucial part of what the pathogenesis. So ischemia will result because of what? Increase in intra-articular pressure, intra-articular pressure. Okay, because this intra-articular pressure is compressing against the blood vessels like these capillaries, then it will result in what? Ischemia of tissues. Now, what are those tissues that we are talking about? The tissues that we are talking about are what? Articular cartilage. As you can see, this articular cartilage, which is this one, okay, there will be ischemia of this. Why? Because this is a vesicular. Remember that it doesn't have blood vessels that are there. It's solely depend on the what? Synovial fluid for what? Nutrition. So meaning that if now here there are some blood vessels, there are some white blood cells that is passed there, and again here in the synovium there is what? Some blood vessels that are being compressed against because of increase in intra-articular pressure. What's going to happen? This synovial fluid is not going to be receiving what? It's not going to be receiving food, nutrient, oxygen like that. And if it is not receiving this synovial fluid, basically also the articular cartilages won't be receiving what? Anything. So what will be the result? The ischemia of what? The chondrocytes, the cartilage there. Okay. And what else? Remember, what is this bone? This is what we call subchondral bone. The subchondral bone as well will result in ischemia of this subchondral bone, or the bone erosion of that subchondral bone. Okay. Now that bone will be now eroded and maybe can result into what? Maybe some certain pathology. Maybe the infection now can start going to this subchondral bone, causing what? Osteomyelitis. Okay. That is the ischemia part. Okay. Now another important part. Okay. Another important part. So another important part is this one now, the Pannas formation. Okay. Pannas formation. So Pannas formation now, since there was ischemia now, the body will try by all means to make sure that the microorganism is removed, like that. It is maybe like transited from what? Acute inflammation to chronic inflammation, like that. If that happens now, what will be happening here is the synovium here, the synovium will start will start proliferating. Okay, it will start proliferating so that now it can cover up those like in the damaged tissue. Okay. Then apart from that, it can also now, it will start also producing what is some certain enzymes so that it can further destroy the cartilage. So the Pannas formation, basically it is because the synovium is now being proliferated. Okay, it is dividing like that and becoming thick, permanently thick like that. That's what we call Pannas. Okay, and Pannas, if you just see Pannas formation in the synovial cavity there, basically the articular cartilage can be broken down like severely. It can be completely broken down, because that synovium or that Pannas that has been formed, it produces further certain enzymes that destroy the articular cartilage. Okay. Okay, then the last important part is this one. The last one is what? Ankylosing. So what is ankylosing now? Ankylosing, basically it means that this joint, this bone and this bone, are going to start fusing together, so that now there will be no joint mobility. Okay, so there will be stiffness of the joint. So ankylosing can result now because there was Pannas, and it's because of this chronic inflammation, and two joints now they fuse together. If they fuse together, there will be what? Stiffness of the of the joint, like that. Okay, very important concept that you need to understand. Now, what we'll do here in the next video, we need to understand about how you can go about the septic arthritis, how you can diagnose septic arthritis using Kocher's criteria, and in adult, how you can use rule-in criteria, and also the general management of septic arthritis. All the best, start well, until next time.